The most dangerous moment of your day might feel completely ordinary. Right now, as you're listening to this, someone your age is having a heart attack. Not clutching their chest, not calling for help, not even realizing what's happening. Just sitting there feeling tired, a bit uncomfortable, maybe a little short of breath, thinking they probably just need to rest. And while they wait, their heart muscle is dying. Not slowly, rapidly. With every passing minute, more damage becomes permanent. That's not meant to frighten you. It's meant to prepare you. Because the most dangerous thing about heart attacks isn't that they happen, it's that they disguise themselves as something minor. They start quietly, subtly, easily dismissed. And by the time the pain becomes undeniable, critical damage has already occurred. In the next few minutes, I'm going to explain something that could save your life or the life of someone you love. There is a brief window after a heart attack begins, roughly 60 to 90 minutes, where medical intervention can stop the damage and preserve your heart function. Miss that window, and no amount of treatment, medication, or regret can restore what's been lost. Once you understand this, you'll never ignore unusual fatigue again. You'll never dismiss unexplained discomfort. You'll never tell yourself to just wait and see. My name is Dr. Catherine Wells, and I've spent 30 years in emergency cardiology watching how small delays during heart attacks turn into permanent disability, and how quick action can mean the difference between full recovery and a lifetime of limitations. I want to tell you about a woman named Margaret. Margaret was 68 years old, active, healthy by all accounts, and fiercely independent. She woke up one Tuesday morning feeling slightly off. Not sick exactly, just not quite right. A vague heaviness in her chest that she attributed to sleeping poorly, a bit of nausea that she blamed on the dinner she'd eaten the night before. She made breakfast. She did some light cleaning. She sat down to read the paper and noticed she felt unusually tired. Not exhausted, just worn out in a way that seemed out of proportion to what she'd done that morning. She told herself she was probably coming down with something. Maybe the flu. That's what most people tell themselves. Margaret decided to lie down for a bit. When her daughter called to check in, Margaret mentioned she wasn't feeling great but said it was probably nothing serious. Her daughter suggested she call the doctor. Margaret said she'd see how she felt after resting. She didn't want to make a fuss. 3 hours later, Margaret tried to get up and felt a wave of dizziness. Her daughter, who had grown increasingly worried, drove over and immediately called emergency services. By the time Margaret reached the hospital, the cardiologist's face told the story before his words did. Margaret had been having a heart attack for over 4 hours. She survived. That's what everyone focuses on. But survival doesn't tell the whole story. Margaret's heart was permanently weakened. She developed heart failure. She couldn't walk to her mailbox without becoming breathless. Her independence, the thing she valued most, was gone. And here's the part that haunts her family. If Margaret had called for help when those first symptoms appeared, if she'd acted within that first hour, the outcome would have been completely different. Same heart attack, same age, same body. Different decision, different life. That's because a heart attack isn't a single moment of catastrophe. It's a process. When a coronary artery becomes blocked, the heart muscle fed by that artery begins to suffocate. But heart cells don't all die instantly. They die in waves. First, they struggle. Then they weaken. Then they die permanently. Modern medicine can interrupt that process. We can restore blood flow and save threatened heart tissue, but only if the patient arrives in time. Cardiologists call this the golden hour. It lasts roughly 60 to 90 minutes from the moment the first symptom begins. Not from when the pain becomes severe, not from when you finally decide it's serious, from the very first unusual sensation. Inside that window, doctors can use treatments that open blocked arteries and restore blood flow, clot-busting medications, emergency procedures that can save your heart muscle. Outside that window, those same treatments become less effective or too risky. Once heart tissue dies, it turns to scar. It does not regenerate. There is no undo button. That's why time is everything in cardiac emergencies. The tragedy is that most people don't miss the window because they're careless. They miss it because heart attacks lie. They disguise themselves as indigestion, fatigue, anxiety, or stress. We've all been trained to recognize the Hollywood heart attack, the dramatic chest pain, the clutching, the collapse. But real heart attacks, especially in older adults and particularly in women, often look nothing like that. They whisper instead of shout. Unusual fatigue that makes you want to sit down. discomfort in the chest that feels more like pressure than pain, nausea that seems unrelated to food, shortness of breath that appears without exertion, pain or discomfort in the jaw, neck, shoulder, or upper back, a vague sense that something is wrong but you can't quite name it. And because these symptoms feel minor, dismissible, explainable by a dozen other harmless things, people wait. They tell themselves it's probably nothing. They don't want to overreact. They don't want to bother anyone. That internal negotiation, that quiet debate with yourself about whether it's serious enough, that is time you cannot afford to lose. Here's something critical to understand. Your heart doesn't care about your plans, your pride, or your desire not to make a scene. It cares about oxygen. When that oxygen supply is cut off, the clock starts ticking. Every minute you spend convincing yourself it's probably fine is a minute of irreversible damage. You've probably heard the warning signs: chest discomfort, shortness of breath, cold sweat, nausea. Those are important. But what people don't realize is that you don't need all of them. You don't even need chest pain. Some heart attacks present with nothing but overwhelming fatigue. Some with only jaw pain. Some with just unexplained anxiety or a feeling of impending doom. Here's a better rule. If you suddenly feel unwell in a way that's unusual for you, unexplained, and concerning, that is your signal. Not to wait, not to rest, not to see if it improves. That is your signal to act immediately. Because every minute you wait is another minute of heart muscle dying. One of the most dangerous phrases I hear is, "I didn't want to call if it was nothing." People say this after the fact, looking back with regret. They assume heart attacks announce themselves clearly. They don't. Many of the worst outcomes come from heart attacks that started mildly, with symptoms so subtle the person almost dismissed them entirely. People often tell me, if I'd known it was a heart attack, I would have acted right away. That's exactly the problem. You don't get certainty in real time. You get a choice. And the rule is simple. If it might be a heart attack, treat it like one. You will never regret getting checked too early. But people regret waiting every single day. There's another reason waiting is so dangerous, especially as we age. Over the decades, our arteries accumulate plaque. Our heart muscle becomes less resilient. High blood pressure, diabetes, high cholesterol, these conditions quietly build up risk like compound interest. Even if you feel healthy, even if you've never had heart problems before, your heart is less forgiving of interruptions in blood flow than it was when you were younger. That doesn't mean heart attacks are inevitable. It means your response time matters more than ever. The good news is that older adults who receive treatment quickly can recover remarkably well. I've seen people in their 70s and 80s return to active, independent lives because they acted fast. Age does not disqualify you from a good outcome. Delay does. What breaks my heart as a cardiologist isn't the heart attacks we can't prevent. It's the ones we almost saved. The cases where someone waited because they didn't want to cause a fuss, because they thought they were overreacting, because they didn't want to bother the ambulance for something that might be nothing. "I didn't want to be dramatic" is one of the most damaging thoughts in emergency medicine. Let me tell you something. Emergency responders are never annoyed by heart attack calls. They are grateful for them. What we dread are the patients who arrive too late, when all we can do is manage the damage that's already done. Pride, embarrassment, and hesitation have no place in a heart attack. Acting fast is not overreacting. It's the most intelligent, responsible thing you can do. And here's something most people don't understand yet. How you get to the hospital matters almost as much as how quickly you decide to go. The moment you suspect a heart attack, the clock is running. What happens next can determine whether doctors can still save your heart muscle or not. In the next section, I'm going to explain why driving yourself or having someone drive you can actually work against you, even if it seems faster. I'll explain what happens behind the scenes when you call emergency services and why those first minutes can change everything. For now, hold on to this truth. A heart attack is not something you wait out. Waiting is not neutral. Waiting is a decision. And too often, it's a decision that costs people their heart function, their independence, and their quality of life. 60 to 90 minutes can feel like plenty of time when you're not in severe pain. But to your heart muscle, 60 minutes is the difference between recovery and permanent damage. Once you understand that, you stop debating. You stop negotiating. You act. And that action can save your heart. If there's one thing I want you to understand clearly, it's this. What you do in the minutes after you suspect something is wrong with your heart matters just as much as recognizing the symptoms in the first place. This is where good intentions often turn into bad outcomes. People realize something might be wrong, but then they make choices that seem logical in the moment but quietly sabotage their chances of full recovery. They sit down and wait to see if it passes. They call a family member instead of emergency services. They decide to just drive to the hospital themselves. And they don't realize that these decisions, made calmly and reasonably, can completely change what doctors are able to do for them. A heart attack is not like most medical problems. It's not a situation where getting there eventually is good enough. Heart attack treatment is a race against time, and every choice you make either speeds that race up or slows it down. One of the most common mistakes I see is people trying to be independent or tough. They think, I can still walk, I can still talk, I'll just have my spouse drive me to the emergency room. That feels faster. It feels simpler, but it usually works against you. When you call emergency services for a suspected heart attack, something critical happens before you ever reach the hospital. The moment a heart attack is suspected, a system activates. The paramedics begin evaluating you immediately. They administer medications that can limit damage, aspirin to prevent further clotting, nitroglycerin to ease the workload on your heart. They record the exact time your symptoms started. They transmit your electrocardiogram directly to the emergency department while you're still in the ambulance. That early EKG is crucial. It tells the cardiac team what kind of heart attack you're having and what treatment you'll need. The catheterization lab is alerted. Specialists are called in. Equipment is prepared. By the time you arrive, a team is ready to take you straight to treatment. Minutes are shaved off every step. When you arrive by private car, none of that happens. You check in. You wait in the queue. You explain your symptoms to a triage nurse. You wait again. You get an EKG. Then decisions are made. Those extra minutes, 20, 30, sometimes 40 minutes, those are minutes of heart muscle dying. Those are minutes you don't get back. There's another reason driving yourself or being driven is dangerous, and it's one people rarely consider. Heart attacks can worsen suddenly and without warning. Someone who feels mostly okay can rapidly lose consciousness, develop dangerous heart rhythms, or go into cardiac arrest. That's terrifying in a moving vehicle with no medical equipment and no one trained to respond. Paramedics are prepared for those moments. They have the tools and the training. Your loved ones don't. Calling for help is not an overreaction. It is the safest and fastest path to treatment. When you make that call, the words you use matter. You don't need to be calm. You don't need to be certain. What matters is clarity. Saying, I think I might be having a heart attack, immediately changes how your call is handled. If you can describe when the symptoms started, even approximately around 20 minutes ago, just before lunch, that information is crucial. It helps doctors determine which treatments are safe and effective for you. There are medications that can dissolve clots and restore blood flow, but they must be given within a specific time window. Without that timeline, doctors may be forced to hold back, even if treatment could have helped. Families play a huge role here, and this is where another common mistake happens. Loved ones try to comfort instead of act. They say, let's just rest for a few minutes. Maybe it's just heartburn. Let's not panic. That instinct comes from love, but it can be devastating. Comfort during a heart attack doesn't mean reassurance. It means action. The most loving thing you can do for someone you care about is to treat uncertainty as urgency. You're not accusing them of being sick. You're protecting their future. Let me address fear for a moment, because fear keeps people frozen. Many older adults worry about being embarrassed if it turns out to be nothing. They worry about the cost of an ambulance. They worry about being a burden. Let me say this as clearly as I can. No emergency team, no cardiologist, no nurse will ever criticize you for coming in with symptoms that turn out to be something else. Ever. What we see far too often are people who apologize for bothering us while we're trying to explain permanent heart damage that didn't have to happen. The embarrassment you fear lasts minutes. The consequences of waiting can last a lifetime. Another thing people don't realize is that heart attacks don't always hurt. There may be no severe pain at all. That's one reason they're so deceptive. People associate danger with pain. When there's no crushing chest pain, they downgrade the urgency. But heart damage has nothing to do with pain levels. It's about oxygen deprivation. Heart muscle can be dying while you feel only mild discomfort, only fatigue, only a vague sense of unease. Comfort is not safety. The absence of severe pain is not reassurance. Only speed changes outcomes. As we age, Many of us become more patient, more tolerant, more willing to endure discomfort without complaint. That's often a strength. In the case of a heart attack, it's a liability. Heart attacks punish patience. They reward decisiveness. The people who recover best are not the ones who stay calm and wait. They're the ones who act fast, who speak up even when they're unsure, who trust their instincts over their pride. I've watched families replay these moments over and over. If only we'd called sooner. If only we hadn't waited to see if it got better. That kind of regret is crushing, and it's avoidable. You can remove it right now by making a simple agreement with yourself and the people around you. If something feels suddenly and unusually wrong with your body, particularly anything involving your chest, arms, jaw, neck, back, breathing, or energy level, you act immediately. No debate, no negotiation, no delay. You don't need a diagnosis, you need momentum. In future conversations, we'll talk about reducing heart attack risk, managing cholesterol and blood pressure, understanding warning signs that appear days or weeks before a heart attack, and building habits that protect your heart over time. All of that matters. But none of it matters if you miss the moment when intervention is still possible. Prevention helps you avoid heart attacks. Speed helps you survive them with your heart intact. So let me leave you with this. A heart attack is not just a medical emergency. It's a decision point. One path leads to recovery, preserved heart function, and continued independence. The other path leads to limitations no one ever plans for. The difference between those paths is often measured in minutes. You don't need to memorize every symptom. You don't need to become a cardiologist. You only need to remember this. Sudden unusual symptoms deserve immediate action. When in doubt, act. Your heart depends on it. And if this message stays with you, if it changes how quickly you respond for yourself or someone you love, then it has served its purpose. Because the goal isn't just to live longer, it's to live fully, independently, with a heart that still works the way you need it to. And that starts with one choice. The choice to act when it matters most. Don't wait. Don't hesitate. Don't tell yourself it's probably nothing. Call for help. Your life may depend on it. If this information could help someone you know, share it with them. Talk about it with your family. Make a plan now, before a crisis happens. Decide together that when symptoms appear, you'll act immediately. That simple agreement could be the difference between a full recovery and permanent heart damage. Your heart has kept you alive for decades. When it calls for help, don't make it wait. Act fast. Act now. And give yourself the best chance at the life you deserve.